This is your introduction to student supervision and assessment for academic assessors. So a lot of you by now will know our new curriculum starts in 2019 and we will be working alongside the new standards. There are 7 platforms and 2 annexes, and the 7 platforms are in front of you, and there is higher emphasis on health promotion and preventing ill health, as well as safety and quality of care. One of the things that we've got to implement into the new programme is experience across all care settings for fields of nursing, and we're going to do that in placement. In year 1 there will be 3 weeks where students will go into placements where they could come into contact with adults and children with mental health diseases or learning disabilities or any of those things, and then again further in their programme they will have the opportunity to experience a variety of care settings. So one set of proficiencies. There are some nursing proficiencies and skills that are required. As I said, emphasis on public health. The other thing that's going to be included is prescribing theory, and as you well know, we will have a medicines management module in year 2. There is an expectation that students actually take a lead in management of their own learning throughout the programme, and so that will be bedded in to the programme throughout. So I said new standards and new assessments. The new roles, that's practice supervisor, practice assessor, and the role of academic assessor, which I'm preparing you for. You will go onto a register of academic assessors as having had preparation, which will provide QA for the NMC. So students' placements are going to be managed in this way. We've got a diagram here of 3 placements. Each placement has a practice assessor who will plan with the student, do the formative and summative, the midpoint and endpoint assessments. However, they will work infrequently with their practice assessor, but frequently with a variety of supervisors who can be any registered healthcare professional or anybody who's occupationally competent, such as a phlebotomist, for example. They will guide their learning and they will provide feedback and evidence for the assessment process. You will have a group of personal tutees who you will be their academic assessor for, and you can monitor their progress throughout the programme, and the route for that will be the practice assessment document, the EPAD, in the same way that you use the EOR. I'm going to talk a bit more about that later on, but essentially at the end of the year, the practice assessor in the final placement will officially agree with you that a student can progress into the next stage. And again, I'm going to talk to you a little bit more about that. So practice supervisors, as said, registered healthcare professional. Don't forget the nursing associates will be registered, and they undertake preparation for their roles, and it's all around about enabling learning and providing feedback on progress. The NMC is expecting them to be role models, supporting their learning, as I said, giving feedback, and receive ongoing support, which their employers will. So they may undertake the initial interview with the student, but the practice assessor has to verify that. It's important for them to raise concerns about students as nurses, registrants currently do now, etc. And obviously there's their role within reasonable adjustments, which is no different from now. So a practice assessor is a RN. They need to have had experience for the student's field of practice or equivalent. It doesn't mean to say that if you're an adult nurse that you can't be a practice assessor for a student on the mental health pathway if they're in an adult care setting or a GP practice setting, for example, and vice versa. Now, whilst it says they may be allocated one placement series, we've actually agreed that they will be allocated for each placement. There will be a practice assessor. If I'm practice assessor for student nurse Jones, I won't be her practice supervisor, which means I won't work with her regularly, but I could be a practice assessor for student nurse Jones and a supervisor for student nurses Bloggs, Smith and whoever else. And so that's the way that works. So their role is to assess and confirm their achievements. It's to manage a failing student, and there are assessments throughout that year that have to be undertaken by practice assessors, which I'm going to talk about in a moment. So, whilst the initial interview and plan with a student can take place by a supervisor and the practice assessor verify it, is a requirement that they underdo the midpoint assessment to give an assessment on the student's professional values in each placement, do the final interview, and assess specific proficiencies as part of their engagement with the student, and undertake assessments of episodes of care and medicines management. And I'll talk about those in detail in a moment. If action plans needed or an academic assessor is to be asked to come into the area because the student's failing, then they need to make sure that that support for whatever remedial activity is needed. So it's a gathering of evidence, and when we're preparing practice assessors, we're preparing them to be robust in challenging evidence that students will gain from others, but gathering that evidence from others because they won't work with the student frequently. This 40% working notion will go. This will no longer take place. Students will work with a variety of healthcare professionals in their care setting, and the practice assessor is a step back, and they will coordinate their assessment process and gather evidence. So their role is to work in partnership with you as an academic assessor to make that evaluation at the end of the programme for progression. Managing difficulties, students, etc., and all those problems that may occur, but also the handover to the next practice assessor. This will be done through ePad. So, as now, people can look back at students' progress in previous placements, and all that will be facilitated through the ePad, electronic practice assessment document. So, an academic assessor, you're a registered nurse with appropriate equivalent experience for the student's field of practice. You're our employees, yes, and what the NMC requires is the student to have a different academic assessor for each stage of each year of the student's programme. So what we are doing is our SNAMS academics are going to be buddied with another academic, and whilst you'll have your personal students for the programme, in year 2, the academic assessments will be conducted by their buddy. So you'll carry on responsibility as personal tutor for your year students in year 2, but their buddy, my buddy, for example, will be doing the academic assessor role for my students in year 2. It's the most pragmatic way we can manage the NMC wants, and the NMC are satisfied with the way in which we plan this. So when you'll get your personal tutor allocation, you will also be buddied with another personal tutor, and you will be able to access that personal tutor's students' records and pad for their second year. So it's about two-way communications between you and practice. You have to review and confirm the student's academic profile and record that in the pad. as well as having an oversight of what's been going on in practice and having a verification interaction with the practice assessor. So here's the process diagrammatically. You'll monitor the progress of your students through their placements through the EPAD, as you're doing with EOR now. You'll ensure the assessment process is undertaken in a timely manner. If there are issues with students not getting assessed in time, you may need to step in, or to get your PDT person for that placement area involved. Obviously, you can provide advice and support for the practice assessor as required, and you need to maybe meet with them if required. If their student is failing, you might need to go into the placement or liaise with the PDT lead to undertake that visit. If risk assessments are required for students, you'll be required to do those, or again get the academic PDT lead to undertake that, but to ensure that appropriate adjustments are put in place. At the end of the final placement in each year, you are to review the student's academic achievement and practice achievement, which can be done by EPAD. If you want to speak, you can talk on the phone, you can have email, or whichever way you wish to communicate. You don't have to go and visit, but you're required to add the academic marks to the EPAD, and once both of you are in agreement, again, we will have this communication through the EPAD. In other words, are you concerned about the student? Are you have you had an opportunity to discuss if required? Yes, yes, yes. Are you both in agreement the student can progress? Yes, you'll click the final verification button. Then the student's results will go to Unit E to go into the exam board. Obviously in Year 3, you'll be confirming that they're fit to be registered as part and parcel of that, the progression to registration. So our programme is 3-year BSc or 6 years part-time. We have a 4-year MSc single or dual registration. You can be either one of these. All our students will have 2-week placements, and these are 8 to 10-week blocks. They are not going to be attending theory during the practice time, so that they can focus on their practice and the needs for their assessment. So we are sharing our assessment tools across the South. We are undertaking our student assessments using one single document across the whole of the Southwest. And so the assessment process, there are 3 parts. MSc students will meet part 3 across their final 2 years, and those undertaking dual registration will have placements in both of their chosen field during the second 2 years. We are not going to be grading practice anymore. All students will require initial, midpoint, final meetings with a practice assessor, and a practice assessor will be allocated to each student that commences the placement in the same way that they're allocated to mentors now. This all constitutes an ongoing achievement record, their orientation, their interviews, assessment of professional values, episodes of care and medicines management, service user feedback is required, and they need to do the nursing proficiencies, and it all is wrapped up in their EPAD. The professional values that they're assessed on each placement are these. There are guidance as to what the academic assessor needs to be looking for, or the feedback that they get from others on how the student is performing. And across the 3 parts, this is what the criteria for the assessment is. Please note in part 3 that students are going to be expected to practice independently, leading and coordinating care with confidence whilst they're being supervised. And please note that it is about proficiency and not just competence. So the episodes of care, there are assessments of episodes of care in each part, increasing in complexity as the years go on. I'm going to talk about them in detail in a moment. So there are different levels of proficiency dependent on the field. This is currently in development and we will be able to launch this very soon. The PAD guidance that is accompaniment to this preparation will also help you understand. But there are 30 proficiencies that need to be done at the end of the programme. Depends what opportunities they have, depends where their placements are. And if they've been assessed as proficient but don't maintain it in subsequent years, they need to be reassessed. Their proficiency can be assessed by practice supervisors, assessors, or anyone occupationally competent, such as phlebotomists, which is what I was talking about earlier. Practice assessors will be verifying proficiency. So, the assessing of episodes of holistic care. So the assessor has to observe an episode of care. It has to be decided with the student, a set time and date. There are criteria that need to be observed and the students need to write a reflection as part of the assessment. The criteria are very detailed. Please refer to the PAD guidance for information. Students and practice assessors may want to take assessment towards an end of a placement. However, if they feel they're ready, they can be conducted at any time. What the practice assessor needs to do is ensure they're both that there is an agreement of the time, date, and the length of assessment. The student should be rehearsing with practice assessors so that they feel confident on the day of assessment. On the day of assessment, the student must confirm they are fit to proceed with the assessment, and they can't decide if things aren't going too well to say, oh, my dad died or my dog died yesterday and it's all going wrong. When we are preparing academic assessors, we're talking about what to do if students aren't performing well and when to make a decision to stop an assessment if it's so bad, although students could object that they weren't given a full opportunity to do that, so they need to take that carefully, and we're training people as practice assessors to do this. So if they're not well, if they say they're not well, they can undertake extenuating circumstances as we do now. Now, any student that's referred or any student that submits extenuating circumstances will undertake a retrieval placement at the end of the year. And redo that assessment, and then they can progress. So the holistic care episodes of care, here they are. In year 1, they need to meet an individual patient service user's need. They do this formatively and summatively. There are opportunities for some formative feedback to the students, so their rehearsals or their dry runs that they do with their practice supervisors. It just needs to be something fairly simple. What we're advocating, what we'll tell the students when we prepare them, is to keep it reasonably simple. It could be doing somebody's mouth care, it could be emptying somebody's catheter, it could be doing an emission assessment, or it could be taking somebody's blood, or doing an aseptic dressing. They have to do a medicines management assessment, and it needs to be, again, for one patient and a small number of medicines. After all, it is their first year. But here are the things that the academic assessor will need to observe, and they've got a 16-point checklist as part of the assessment. In the second year, or stage 2, they have to do they have to give care to 2 patients, or on 2 occasions, shall we say, care of a patient service user more complex needs. Again, here are the things that the assessor has to look for and understand. And again, it's depending on the care setting. So it could be a visit, or a working patients in a clinic situation like an asthma clinic, for example, in GP practice, or even community nursing, or if they're with cardiac rehab team, it could be a cardiac rehab session. Again, in the ward setting, it could be, right, those 3 patients, so I want to see how you're doing there. or again, it could be giving care instead of maybe a small part of the care for a patient is like giving care for a morning. So, Mrs. Bloggs with COPD needs help with personal hygiene, is on a fluid balance chart, needs to have some respiratory assessments, and will need their vital signs taking. So you're going to spend an hour or so with that student doing some bits and pieces there, undertaking assessment. The other thing they have to do is a medication administration. This could be separate, or it could be part of this caring of a patient with complex needs. Students who are doing MS Masters for dual registration would be expected to do one episode in one field and one episode in another. In year 3 and year 4, then, for master's students, they have to undertake a peer teaching and learning episode. So again, here is the criteria, and this is where it's quite crucial that they need those opportunities to rehearse these skills, because they have to supervise and teach students and colleagues, but they actually have to appraise the quality of the care that is given by those junior students then, documenting their performance and promoting reflection, providing constructive feedback to them. So this is not something that we've done before. Again, you're looking at opportunities for peer coaching, peer teaching. So CLIP obviously provides those opportunities, but the assessment will probably take half a day. I want to see you manage a team for a group of patients for a few hours. I want to see that peer teaching, and I want to see you giving feedback to the student on their performance, etc. The other one is leading coordinating care. So again, it probably again is a half-day minimum, where a group of patients are requiring care, and they're basically to demonstrate they can manage a team and manage the patient care that's required for a group. In the community, this could well be, as they do now, a caseload of a group of patients, and again, it would also require preparation, rehearsal, etc. Again, they're required to do medicines management assessment for a group of patients. Again, it could be part of the coordinating of care. They could do the medicine administration for those patients. For adult nurses, if they're in a care setting where their patients require IV drugs being administered, then they will be required to administer those IV drugs. This is very short. It's a briefing. Obviously, people are asking me lots of questions. I'm more than happy to answer questions, more than happy to talk to anybody individually about their roles as academic assessor. Hopefully, this has given you some insight. The associated documents are the PAD guide, user guide, and also the PAD itself, and the booklet that goes with this.